Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with Dr. Susan Maples. How are you this morning?
Very well, thank you.
Good. Thank you so much for taking a few minutes. I'd wondered if you might just briefly introduce yourself to our viewers.
My name is Dr. Susan Maples. I'm a general dentist practicing total health in Lansing, Michigan.
And one of the reasons that we're on today is that you practice total health. And tell our viewers a little bit about what that means in your practice.
So we're really setting an example of how dentistry can position itself to take a bite out of the sinking health in America. And Michigan has a lot of health issues. So we're looking in the mouth and seeing the mouth as a window of opportunity to look for what else is going on in the body, as well as helping educate the patient about how oral disease impacts the body. So both ways, what we can tell by looking in the mouth and navigating the body through that, and then educating the patient about oral health.
And I know one of the buzzwords that's been out there has been the oral systemic link. And I know that that means different things to different people. And I was just wondering if you could kind of expand upon what that means to you and in your practice.
I'm so glad you asked that, Kevin. That's actually kind of a pet peeve of mine, is that we now have associated the oral systemic link with periodontal disease, heart disease, and dentists say, oh yeah, I get that, I know that. We're going way beyond that. We're looking for things. Of course, periodontal disease impacts lots of other systemic issues, including, inflammation, chronic inflammation. What does that do? The traveling oral microbiome, how it affects different organs, the heart, the liver, the brain, all of that, everything from erectile dysfunction to Alzheimer's. But we're really looking at non-bacterial things too, like chronic systemic inflammation from food sensitivities and toxicity, but also HPV and oral cancer. I don't know if you're aware that by 2020, we'll have more oral cancer from HPV in men than we'll have cervical cancer in women in the United States. That's like right around the corner, growing at like 30% a year. We're able to see acid reflux, which is the precursor to Barrett's esophagus and oral esophageal cancer as well. We're looking at all kinds of back and forth relationship between diabetes and periodontal disease. So we can actually detect prediabetes and diabetes in the dental office and help people turn the ship around so they don't end up losing their eyesight or their kidneys or their limbs to find out they're diabetic. We have 77 million unknown diabetics in the United States. So sleep apnea is another really big one. Again, not related to bacteria, but we also know that it has sort of a one-to-one correlation with AFib, heart disease, as well as heart attack. We have an increased risk. And with sleep apnea, we're able to look at physiologic and physical factors inside the mouth and around the head and neck, and be able to determine risk from just looking, let alone asking questions about daytime sleepiness and things like that. So it's a really big arena.
It is, and it brings about some very interesting questions and discussions to obviously have with patients. How receptive have you found patients to be whenever you've started discussing these topics with them?
Amazing, amazing. We're saving lives and they're attributing it to us, and that's been really fun. We also write lots of letters to physicians. So we communicate with physicians about patients and give physicians information. Like 76% of physicians aren't screening for sleep apnea, and probably an equal number not acid reflux, unless the patient goes in with really distinct symptoms. The earlier silent symptoms they're not catching. So when that happens, we get referrals back from physicians as well. So we have a number of physicians in our practice and other healthcare providers, and lots of referrals. And we're practicing it with kids too. We do whole health science experiments with every child at every visit, and that's attracted a lot of young families. So it's been really fun way to practice.
I think you were kind of reading my mind, because I was going to ask you about the relationship that you had with the physicians in your community and how you kind of started that and where you see that going and even growing in the future.
Well, I'll give you a quick example. Yesterday we had a child in who was 16 years old, and in the hands-on learning lab, they did an experiment with a long balloon and fashioned it as if it was a blood vessel to show what blood pressure was, and then put the cuff on him to show him what the two numbers meant for him. And he was hypertensive. we got to the bottom of looking at his nutrition and the fact that he was overweight, what he was consuming, 4 power aids a day, and kind of got to the bottom of that. And then we're able to write a letter to his physician stating that what we had talked about and what his pressure was and how we've asked him to stop power aid for 3 weeks and come back and kind of look at his vitals again. Those kinds of things when pediatricians aren't really, I mean, he doesn't even have a family doctor yet. He's still sort of transitioning from his pediatrician. Those are huge, and that's just a child. So the response has been great. Everything from psychiatrists to heart doctors, and it's really the best way to get the word out to our medical community.
That's very cool. What's the one piece of advice you would pass along to your dental colleagues out there about maybe something they're not doing in the practice that they should be?
Start something. Start something. We have to think outside the box. We have incredible problems in our future. Like in 2012, we had 16 million diabetics, and we're going to have 103 million diabetics according to the CDC by 2050. The cost is going to cripple our country, and we are the only preventive relationship left on the planet. These people come to us for prevention, and what we're doing inside our preventive visit isn't all that preventive. We're watching caries rates go up, and periodontal disease go up, and oral cancer go up, and occlusal disease go up. So use that preventive appointment to prevent something that could really be life-changing in addition to what you're doing, and rethink the whole paradigm around healthcare so that we can become a more pertinent player in this sinking health.
And I know that you're very active with a group called AOSH, and it's really trying to shift the paradigm within the dental community. And I'd wondered if you just might take a moment and tell our viewers about AOSH.
AOSH is amazing. It stands for American Academy of Oral Systemic Health, and it's the only gathering of its kind, and it's once a year, where we bring in physicians and dentists who have studied well to teach us about all these connections and actually implement them so you can go home knowing how to do salivary diagnostics and how to look at bacteria differently and how to look at disease progression. How do we test for HPV in saliva, all of those things. So it's it's a life-changing experience for clinical team as well as the business team and the practice to be able to talk about what is a total health practice. And this year it's in, I had my sunglasses on, sunny Orlando, Florida. So a great place to bring the family to, and I think people will enjoy that. It's at the Gaylord Palms Resort, which is a really neat resort, and I'm really excited. This will be a big one.
Very nice. And we have the website for more information here along the bottom of the screen, so you can check out AOSH and the upcoming meeting. And Dr. Maples, I was wondering, is there a way that if viewers would want to contact you about how you're doing things in your practice, is there a way that they could get a hold of you?
Absolutely. You can reach me through my website, Susan at drsusanmaples.com or blabbermouthbooks.com. I did write a book, Blabbermouth, 77 Secrets Only Your Mouth Can Tell You to Live a Healthier, Happier, Sexier Life. And that book actually is a great read for dental teams. It's written for everyone to understand, and it tackles all of these areas in 3 or 4 pages with all the research in it. But it's a nice intro to all of the things that are possible. So that would be helpful too.
And I'll just have to put in a plug that Dr. Maples actually sent me a copy of her book, which I appreciate very much. Thank you so much for doing that. And thank you. I
can't say enough about AOSH. Really come. It's really life-changing, and bring your whole team. If there's one meeting a year you're going to get your team members on an airplane to be at, this is the one.
Very cool. Dr. Maples, thank you so much for your time this morning and sharing your expertise. I really appreciate it.
Thanks. Bye-bye.